Hardy from Macomb City Hall. This is Macomb Mayor Mike Inman with our most recent update on the COVID-19 pandemic here in Macomb and McDonough County. It has been a while since we've had a chance to talk. Apologies, we've had some, the holidays among other things, and plus we've had some staff issues here with folks dealing with the pandemic amongst staff. So some of this information maybe seem significantly different than what we talked about last, if you're keeping track. This is the most recent data from just about 15 minutes ago from the McDonough County Health Department as of today. So currently 2,016 confirmed cases of COVID-19 since the onset of the pandemic in March. Currently dealing with a total of 61 active cases. And for those of you who are keeping track, yes, that's maybe close to 150 cases more than when we talked again about 2 weeks ago. They unfortunately are reporting an additional death since we last talked that occurred this past weekend. So we send our condolences to the family who suffered that loss. Again, the pandemic is still very much prevalent in the community, and we're again asking you to remain vigilant, wear your mask, social distancing, and washing your hands frequently. And you're probably hearing some information at the national level regarding a variant of the COVID-19 virus that's become prevalent in other parts of the world and now starting to show up in different states here in the United States. Need to be vigilant as that rolls out now. The latest information is that it's not necessarily more deadly, it's just more contagious. It's some sort of adaptive ability to make itself more contagious. I'm not an expert, I don't know what that means. It just means to me that we need to be continually vigilant in wearing face masks and social distancing and washing our hands. And you might say, oh, but we have vaccines now. That's true, and we're going to talk about that here in just a minute. The idea behind the vaccines is that it's to provide certain vulnerable groups with some immunity, and that immunity is not instantaneous. You may be following some of that, and again, we'll discuss that here in just a minute. We're going to talk a little bit about testing. Testing is ongoing, both at McDonough District Hospital's drive-through testing program, 8 to 4, Monday through Friday, and those hours on the weekends, they're being displayed at your on the bottom of your screen now. That's on the campus at MDH. Now, we just got through with a series of testing over the last week to 10 days that was put on by the Illinois Department of Public Health on the campus of Western Illinois University. It was available community-wide, had good response rate from the community. I availed myself of the opportunity to be tested, I think it's 3 times now. Most recently yesterday, went through the process at the Tanner Circle on the Q lot at near Tanner Hall at WIU. About 3:30 yesterday afternoon, I got the results texted me just shortly after noon today. So very quick turnaround. It's not the really invasive type of nasal swab. I think there are some additional opportunities for IDPH testing coming up later this month. We'll give those to you now with some reminders as we meet again over the next several weeks, but they're appearing on your screen now. This is IDPH testing near Tanner Circle on the campus of Western University, Q lot, the southeast corner of Q lot. It's available to everyone in the community. It's not restricted to just students or faculty at Western. It's everybody. It's just a large parking lot, so there's plenty of line or space there to line up, queue people in the line. It's not a lengthy process, but upcoming dates to remember are January 15th, 23rd, and 24th. Those are on your screen now, and then we'll give you some reminders again later, with a very rapid turnaround, and we're grateful for that. As we talked about just a few minutes ago, there are active vaccines available. We've had over 1,000 opportunities for vaccines in McDonough County since the rollout just a short 2 weeks ago. Some of the most critical folks have been vaccinated or at least received their first round of vaccination, and again, that's part of the complexity of this. Full or the most effective coverage for the vaccine does not occur until the second injection has been given, and that's somewhere between 21 and 28 days after the first injection of the vaccine, whether it's Pfizer or Moderna, whichever one. Both are being used in the community. Healthcare workers, EMS, those critical frontline folks have received their first dose. They're in the queue to receive their second. Also, the health department reported this morning that all 5 long-term care facilities for the elderly here in McDonough County have been well vaccinated. I can't sit here and attest to that 100% of the population, but it's a very, very high percentage of that population has been vaccinated since we last spoke. Some have recently, within the last couple of days, has that been done. So that very vulnerable part of our population has received their first dose of vaccine and have some coverage. Again, full efficacy, or I should say full benefit of the vaccine is not achieved until several days after the second round of the vaccine has been administered. So again, that just underscores how important it is to remain vigilant on the mask wearing, social distancing, and hand washing. That even though the vaccine started to roll out, to be fully effective to the maximum extent is still several weeks away. So we still have to be vigilant there. Speaking of that, our efforts have been paying off in our vigilance, in that the county's current positivity rating is, as of the 1st of January, was 5.7%. The region remains at 9.5%, and two of the matrix that are still indicating that the mitigation needs to continue, or is that we're still in the region seeing above, however slightly above it is, above the 20% threshold for medical surgical beds available in the region and ICU beds availability. That's still slightly above the threshold. It is slowly but surely trending in the right direction. So that gives me some hope that we're got some good light at the end of the tunnel as far as not only the mitigation, but the most serious impact of the virus. For now, seems to be subsiding. Again, I think you're hearing at the national level, and there's been some discussion here locally, that the possibility of a slight resurgence due to folks that were not compliant with mandates and CDC guidance over the holidays. Most recently, would have been the New Year's Eve opportunity for folks to gather. So maybe in the next 10 days or so, we should see if those efforts truly paid off, and we can start looking in the rearview mirror at some of these mitigation efforts that the governor has implemented. Again, those decisions are made by him. We're anxious just as much as anyone else to be relieved of some of those, but under the right conditions. So some other information I want to share with you is that there is ongoing planning between our partners in the county for the mass distribution of vaccines. That plan is continuing to be tweaked and honed for the inevitability that is coming. Again, probably several weeks out before we get to the point where we have the volume of vaccine to start asking members of the general public to be vaccinated. There's still some high priority groups that are waiting to be taken care of, but we continue to receive vaccine for distribution on a limited basis every week. So we're grateful for that opportunity. Some other things, and again, there will be plenty of information sharing when that time occurs, when that's open to the general public, or for other more prevalent risk groups that are part of the greater population. Some other things going on, I want to remind those small businesses that the Small Business MicroGrant Program, that's a program where the city applied for and received $200,000 in funding. This is in addition to the outdoor seating grant that was offered to bars and restaurants earlier, but this is an additional $200,000. The deadline for applying for that's again, we're trying to meet some criteria set by a state agency for the distribution of those funds. It's this Thursday, the 7th. So if you think you at all qualify, please reach out to the Office of Community Development. That number is at the bottom, or MaidCo is helping us with the application process to try to get as many businesses in that program as possible. You can reach out to MaidCo there. Both those numbers are on the bottom of your screen now. Again, the important thing is the deadline is this Thursday, the 7th, for those applications. We want to get as much as that, or all that money is the goal, into hands of small businesses that have been impacted by COVID-19. Now, some caveats, and again, if you have other questions, our community development folks or MaidCo can help you with that. But if you've been the recipient of a big grant, the business interruption grant, or any other grant, you may not qualify, but my suggestion would be make the call, make sure, don't pass up the opportunity if it indeed is there for you. We'd also like to remind folks of the convalescent plasma treatment that's still out there. We still have plenty of folks that, as a matter of fact, the most recent number says that there are there are over 1,900 recovered cases in McDonough County. So to those 1,900 folks here in McDonough County, if you've not had a chance to reach out to the Mississippi Regional Valley Blood Center here in Macomb, that number's at the bottom of your screen now. Reach out to them, see if you can get in the queue for donating plasma so that folks that are critically ill with COVID-19 may be able to have access to a supply of convalescent plasma to help them in their recovery. So that's important. Again, make the call. 1,900 people have the opportunity to take something that was not so good for them and make it into a real positive for someone else. The kind of things that we like to do here in Macomb because we care. And speaking of caring, we have a brand new president at Western Illinois University who took his position, Hui-Yu Huang. We welcome President Huang to his new position at Western. He started effectively the 1st. We've had some conversations as recently as yesterday, anxious for him to get settled in the community. We want to welcome him with all of our hearts and tell him that we're glad he's willing to come here and partner and to make Macomb and Western the best place they can be. So again, we have some light at the end of the tunnel. Vaccines are being distributed. We have, I think, a robust testing program in place, especially if you factor in those folks that are coming from the Illinois Department of Public Health and setting up at Western, and combined with what we're doing at MDH. Again, I think we have a robust testing program. Things are falling into place as far as the long term and looking towards the future where we may be looking at this in a rearview mirror. We would ask you again to be very vigilant. And I get what I'm asking. Any number of you, and including me and members of my family, we're getting to the point where this is, more than burdensome, but we want to keep everybody focused on the end game here. The ball is still in play in our favor, and we have the ability to control some of this, and to the extent we have that ability, let's make sure that we still are. So we'll not make it so long between our next times together. It'll be more frequently. We apologize for that, but for now, that's it. Thank you.